Hey, this is Sandy.
And Randy.
And we're here on AT Corner.
Being an athletic trainer comes with ups and downs, and we're here to showcase it all.
Join us as we share our world in sports medicine.
Welcome back to another episode of AT Corner. For this episode, we have a great interview guest for this one.
We are talking to Leslie Cardoza, who is not only an athletic trainer, but also a physician assistant.
Yes, Leslie graduated with her Bachelor of Science in Athletic Training from, you know it, Cal State Fullerton, baby. Go Titans. And then she completed her Master of Physician Assistant Studies at USC. She's been an ATC since 2011 and a Certified Physician Assistant since 2016. She currently works for Carbon Health Urgent Care. She has worked in orthopedic surgery when she graduated from PA school and then transitioned to that urgent care. She is a proud ATC and still works alongside other ATs per diem. You can also catch her teaching a suturing workshop at FWATA for us old-time ATCs who it wasn't part of our curriculum. And I'm sure there'll be more from Leslie.
Yeah, because she's already done a few.
Oh, yeah, absolutely.
I can attest, it's pretty awesome.
I know, I have not been lucky enough to go to the workshops yet, but hopefully soon. I want to learn.
Without further ado, here's Leslie. Randy, you want to get us started?
Yes. So as with any interview, we have to go into some cryo breakers. We're breaking cryo here. So what made you become an athletic trainer?
So I don't want to be cliche like most people are, but it is a cliche story. I did get hurt in high school. And I remember it was a cross country meet and I was told to go see the athletic trainer at the school. I had no idea who they were. And I found them. There was like between the two locker rooms, a smaller room at my high school. Found them. They helped me out. And it was actually my dad. So funny story. My dad was like, oh, why don't you just follow the athletic trainer and go see what they do? And I was like, okay. And then like my sophomore year, I actually like started just following her more and more. And that's kind of how I got involved, is just following her. And she had ties with Cal State Fullerton. So like, that's how I met a lot of like the Fullerton staff that was and faculty that was there. But yeah, I got her, went to go see her, and then just kind of followed her around and really enjoyed what she did. I was also still playing softball at the time, still running cross country, but I realized that, yeah, I'm not going to go on and play college softball. I'm not going to go on and run cross country in college. So it's time to like think about my career. And I just enjoyed it and ended up being like something that I wanted to do. So I just continued to pursue it and apply it at Cal State Fullerton. But yeah, that's kind of how I got started, was by getting hurt. And then my dad like pushing me to like, go do that. Go see what's going on.
Well, first we just have to say it, go Titans. And
Yes.
then second of all, you put yourself through that torture to run cross country, huh?
Yes, I did. I actually like really enjoyed it. And I did it in middle school too, but I don't think it was like, I don't know what I was thinking. Now I look back, I'm like, what was I thinking? Like, that was fun. And like running 6 miles for practice. My running days are over.
So you say that story was cliche, but I feel like we need, like, it makes up so much of our profession. We need those stories.
Absolutely.
Yeah, I would agree with you. I just feel like everyone's like, oh yeah, I got hurt. But yeah, that's how we get discovered as athletic trainers.
But you know what's funny is like, yeah, like the subject matter of it's always the same, like, oh, I got hurt. But how each one stumbled into after being hurt is very interesting. It's very unique.
Mm-hmm. Yeah, definitely.
So what made you move on and pursue PA?
So, well, I was at Cal State Fullerton finishing up my undergrad. Here's another funny story. My dad, of course. So when I went to Cal State Fullerton, I still remember this. And I still remember telling Dr. Curcia this in my interview, and telling him, I'm going to be the athletic trainer for USC football team, and I'm going to like follow them around. And then when you start getting more and more involved in college, you realize like the time commitment and I love the time, like love how the athletic trainers now are great at all that. But for me, I was like, oh, I guess that's not really what I want to do. So I just started to take more classes in like bio and biochem while I was at Cal State Fullerton. and really liked the gen med part of everything. Really liked, because I knew what happened when I sent the athlete to the urgent care or to the doctor's office, but I like never knew what happened from then on.
Mm-hmm.
And that just really intrigued me a lot more to really pursue PA. So my dad's like, why don't you go follow this PA I work with and see if you like it? And I was like, okay, Dad. And yeah.
Man, thanks, Dad.
Yeah, exactly. Thanks, Dad.
So this one's always a fun one. We've had a lot of unique answers for it. What is your athletic training spirit animal? This could be any modality, rehab tool, tape, braces, etc. Any tool of the trade that you would say represents you.
Okay, I've been thinking about this. And I would say just like athletic tape. Could you think about it? And it's so like flexible, like you can tear it and put it anywhere. You can close wounds with it. You can pretty much do anything with tape. It's like duct tape. Like if you have duct tape in your house, you can pretty much fix most things in your house. And I feel like for me, just being flexible, like learning new things, like being flexible from being an athletic trainer. I mean, when you're out in the field or you're out working an event, sometimes that's all you have is like that and scissors, and you got to figure out how to take care of this athlete. And even as a PA to an urgent care, I feel like I'm in the same boat sometimes. It's like, this is all I got, and I got to figure out how to get this patient A, B, and C. So I would say athletic tape for sure.
Nice.
Not like Johnson & Johnson. Oh, sorry.
Are you the Zonus instead of the coach?
I think I'm more of a coach. So that's where I've always that's where I started, was coach. So
going back to those roots.
Exactly. I'll never forget.
So let's actually kick off our main topic with a story, experience, case study, something that pushed you to pursue becoming a physician assistant.
So I know as a athletic trainer in undergrad at Cal State Fullerton, we were required to go do shadowing at one of the local orthopedic places. So I shadowed the PA there, and it was actually not really shadowing. I think it was just like watching the surgery, and I loved what she did. I thought it was so cool that she was like so involved in like getting the ACL graft and like putting it together. And I was like, this is cool. I could definitely see myself doing this. So I actually kept following up with her, emailing her, and then I just started following other PAs and seeing like, what's the whole scope of practice? Like, what can I do as a PA? And I think that was actually like the first time I've ever really saw a PA and what they did. But yeah, that definitely pushed me. So I guess you can say athletic training pushed me into being a PA or vice versa, because it gave me other opportunities as well.
Nice. That's awesome. That's really cool. I was going to say, man, how'd you find the time to shadow, a PA as either an athletic training student or as an AT, being certified? That could be tough. Large time commitments there.
Yeah, definitely. Yeah. It was just the surgery requirement that we were supposed to do.
That's cool.
Yeah.
All right, Leslie, what is the proper terminology when talking about PAs? I know there's a little bit of confusion and there's a few changes upcoming too. And
you know what's funny is it seems like, we're used to this as ATs in general.
Definitely. Yeah. It's funny you bring that up, Randy, because I feel like ATs and PAs are so similar in like so many different ways, like even the education stuff. So yeah, it's funny that you say that. But definitely we do not belong to the physician. So we're not physician's assistant. We are physician assistant. So there's no apostrophe S like National Athletic Trainers Association. It's not apostrophe S, same thing. And right now, recently, I guess I'd say within the past year, they're trying to, well, further than that, even when I started getting into PA, they've been trying to change the name to physician associate. So that way it kind of sounds like we work together, which is basically what we do. We work side by side. We see the same patients. I work with an MD right now. I see my own patients. He sees his patients. And he's there if I have questions and vice versa. Because it's kind of interesting that there's, like, from my experience being an ortho background and his experience being family med, like our skills, we can come together and we can collaborate, which I think is great. But physician associate, depending on like how everything's written, especially with like legal issues and stuff like that, and like scope of practice, that eventually will come into play, but that's going to take a little bit of time. I would say at least another like 5 years.
Okay.
Or so. Yeah.
I feel like in the long run, that's actually not too bad.
No.
5 years is like a blip.
Yeah. So
I'm-
we'll see. Hopefully that will be coming soon.
Yes, fingers crossed. That would be
Fingers
much
crossed.
needed.
Yes. Yes.
I'm glad you brought up like working alongside, physicians. How much does your scope differ from a physician's scope of practice?
So by legality issues, I guess you could say, whatever the physician, it's basically written that whatever the physician can do, I can do except surgery by myself. So right now I work in urgent care. So my scope of practice is basically whatever my supervising physician's scope of practices. So I diagnose patients. I see patients on my own. I'm prescribing medications on my own, reading x-rays, interpreting labs, treatment plans, all of that I do, and the same thing that my supervising physician does as well. But we work, like I said, work side by side. And they say usually what we do is like we'll send like a patient who's a little more complicated to them. But I know so many PAs that have handled complicated patients. I mean, some of the primary care PAs that I work with, they'll deal with family medicine, primary care, and they're definitely seeing the same amount of patients or the same complex patients as MDs.
That's crazy. I didn't know there was that much independence in being a PA.
Oh yeah, definitely. It just depends on your comfort level and the supervising physician. And I say supervising physician because in the state of California, he or she's required to sign off 10% of our charts.
Oh, okay.
But I mean, they do.
Of course,
legally, they have to. But yeah, most of the time it's all. I mean, you're by yourself. So.
And I was gonna say, if anything, shoot, like that's a big probably load off the attending physician and the practice itself, because maybe you can see more patients, having access to a PA.
Definitely. Yeah, definitely. Yeah, I mean, you can probably get in quicker, an appointment quicker with a PA versus an MD, and we're going to do the exact same thing.
So you said you worked in an urgent care. What other settings do PAs work in?
Ooh, I was just thinking that.
So PAs can work in pretty much any setting, hospital setting, clinic setting, military. Yeah, I mean, any setting that allows PAs to work in. I'm trying to think what other, I mean, any specialty for the most part. I know what most PAs work in. So like orthopedics, OB-GYN, dermatology, neurology, GI. So yeah, PAs can work pretty much in any setting, any specialty.
Nice, that's cool.
And yeah, the good part about being a PA as well is that you can always change specialties as well, and you don't have to go back to school. So I think that's probably one of the biggest differences between an MD and a PA. If an MD wants to change their specialty, they have to go back to school.
Yeah, I don't know too many MDs that are willing to go through that.
Yeah, exactly.
Is there like a lot of learning on the job then?
Definitely. Yeah, definitely. Yeah. And in your rotations too. But yeah, I would say like your first 3 years, just like as an athletic trainer, your first 3 years is all just learning and just soaking everything in that you can.
I was going to say, after you get certified, that's what you realize how much you actually don't know.
Right.
Correct. It's the same in the PA. I mean, I should say that, but yeah, it's true though.
I like how you brought up similarities between, PAs and ATs. So we like to kind of try and define what can each profession do. So what can PAs do that ATs cannot do?
We can prescribe medication. That's a big thing. I think interpreting x-rays, but I mean, athletic trainers are doing that as well. I know a lot of athletic trainers that can do that. I've always actually said, it's kind of funny you bring this question up. I've always said, like, I feel like an athletic trainer could work in a clinic like an urgent care and almost do very similar things to as a PA does, except they just don't have certain licensing or able to prescribe medication. But as an athletic trainer, I mean, you see a patient, you get a history, you do a physical exam, and it's a treatment plan. That's kind of what PAs do as well. I mean, we can order labs. As an athletic trainer, you can't order labs really.
Yeah.
Injections, you can't really give injections. quite yet. I mean, we'll see.
And I think that speaks volumes to just the education of athletic trainers.
Right. And the growing education.
Yes, seriously. Even from when I mean, I'm not even that old or that past my, graduation, and they're teaching like kids IVs and suturing. Like that's a part of the curriculum. That wasn't a part of my curriculum.
Yeah. IVs and suturing are now part of the athletic training scope of practice.
That's crazy.
I'm actually teaching suturing workshops, so.
I know. I every time I always miss them. It's all like it never works with my schedule at the convention. I'm like, dang it.
Yeah, it's okay.
I can say it's worth it.
You.
I know. I'm trying, Leslie. I'm trying. I got to get there. I need to get my suturing prepped and ready.
Yeah, you got to get there.
We have the practice kits, so
we do.
I just need to be taught it, and then I can practice.
Perfect. There you go. I'll teach you.
So on the flip side, is there anything that ATs can do that PAs can't do?
Let's see. Not too much. Like I see a lot of overlap, to be honest with you. There's a lot of overlap.
Yeah, I imagine you guys don't learn taping, or do you guys do splinting, casting?
We do splinting and casting, yeah. But I'll tell you, as an athletic trainer, you get a lot more detailed splinting and casting than you do
okay.
in PA school.
That's good to know.
Yeah.
Or rehab.
Yeah.
Rehab,
yeah, that's a good one. Rehab, no. Even like the modalities, I've seen like, because, you get your physical therapy forms and you have to refer patients out.
Mm-hmm.
I've seen, PAs just like, check. And I'm like, do you even know what this modality is? Like, do you even know? But yeah, I definitely think rehab, because I know a lot of patients who come in, they just need like a couple exercises here and there to help them. But yeah, that's actually a good one.
I'm glad you brought up rehab, because I was thinking they also have this. Do PAs, are they in the specialty of like physical medicine and rehab, PM&R?
There are some. I know some facilities that do offer that.
Okay.
That do offer that. Yeah. Yeah, it's very far and few, but yeah.
Oh, okay. Interesting.
Mm-hmm.
So with how tight knit it seems that ATs and PAs can be, how do they collaborate with one another? Like, I know there's so many different settings. Have you seen how ATs are able to collaborate with PAs?
Personally, I haven't. As far as actually, I feel like if an athletic trainer is sending, like I've seen at my urgent care, athletes getting sent over for like an X-ray, or they need a splint or something that they can't provide either at the high school. I see high school students a lot of times that come to my urgent care. Mm-hmm. So I definitely see the collaboration, and I'll write, if I know the athletic trainer is sending them for like this and this and that, I'll send back a letter or something that says, hey, this is what it is. This is what I think you should do. These are my recommendations. So I definitely see like collaboration, especially in my setting, in an urgent care setting, because you think about it, your athlete's hurt, it's 6:00 at night. Where are you going to send them? You can't send them anywhere. It's 7:00 at night. You don't want to send them to the ER, so right. You'll send them to the urgent care, or it's the following day, you need an X-ray just to make sure. So yeah, I definitely see a lot of collaboration with local athletic trainers.
And I'm sure the ATs appreciate getting a nice detailed letter.
Definitely, yeah. Instead of from the patient or the athlete, I don't know.
They said something about my knee.
Yeah, something about my knee. I don't know if it's broken.
So that's what always gets me is like, when we were students, right? We always do the doc visits, so we write everything down, and our team doc explains everything beautifully, and then we heard the same thing, and then we get back to the athletic training room, or they're talking to coach, and coach asks, "Well, what'd they say?" And the first thing they always say is, "Oh, I don't know."
Yep.
I'm like, well, here's what they said.
Yep, exactly. And don't worry, athletic training prepared me for that, because in the urgent care, I see that all the time. It's the wife that goes in, or the husband goes in, and I get a call from the wife later, like, my husband said you prescribed him this, and what do I have to do? And I'm like, oh my goodness. So I definitely think I've been well prepared for that.
Oh yeah, that's AT 101 right there.
Mm-hmm.
Do you feel like being an athletic trainer before transitioning to a PA, other than ortho, do you feel like it helped you?
Yes, definitely. Oh, for sure. I mean, going back just to the education, you're in class so many hours a day, then you're going off to your sites, you're going to work with your team or in physical therapy. That's how PA is structured as well. You have your first year and a half of didactics, and then you're going out and you're in clinicals. So I definitely think things are structured very similar. Even just taking the board exam, having already taken the BOC, and then like knowing, okay, I can do this, I can pass the exam, gives you a little bit of confidence, not a lot, just a little bit of confidence when it's time to take your PA exam. So I definitely think there's a huge overlap, and I feel like being an athletic trainer really helped me for sure.
Is there anything that you wish you would have known before going into PA school?
Probably to take the first summer and before you go into PA school and just travel the world and don't study at all. Just enjoy your life because, yeah. And yeah, I think that's probably the biggest thing. Also, like, save your money too. Like, don't splurge all your loans. But yeah, I think just enjoy it before you get into school. And then once you're in school, I mean, have fun. When you're in school, go out. I mean, don't go out every single night, but like enjoy it. Like have a good balance. I think that's the big key. I mean, I think that's for anything in life, but just have a good balance because you're gonna burn yourself out for sure.
And I think that's what makes going through those programs special. Because like I always think about like our time as athletic training students and just the bond that we all shared, but going through adventures like that.
Yeah, definitely for sure.
Speaking of burnout and overextending yourself, what are your hours like?
So right now I work in urgent care, so I'm there 10 hours a day, so 9 to 7.
Mm-hmm.
We'll say 10 and a half. I'm there 8:30 to 7.
Mm-hmm.
And I work about 3 to 4 shifts a week.
Okay.
Depending
nice.
on how, yeah. So sometimes I get a little crazy and we'll work 4 or 5, but definitely like going back to burnout, I don't want to burn myself out because it's just not fair to the patient, not fair to the staff. But yeah, I'm fortunate I can rearrange my schedule so I can like go somewhere or something comes up.
On those, like, because you said around like 3 shifts or so, like on those non-shift days, are you ever on call or are you like actually like, no, I'm off?
No, I'm off.
Oh, that's
I'm
nice.
off. Yeah. I even like turn off my like messaging, like do not bother me until I get back.
I think every AT would just dream of doing that.
Yeah. Yeah. I mean, I always get a phone call like, oh, hey, so-and-so needs help. But the good part about like where I'm at, the clinic I'm at, the clinician that's working that day will take care of messages. So if there's like, you need clarification on medication or the patient has a question, that in clinic person. So we all take turns, we all rotate. But yeah, when I'm off, I'm with my dogs, we're having fun, and that's my day off.
Nice.
Mm-hmm.
Nice. That is good. So is there anything that you miss about practicing as an athletic trainer?
I miss a lot about athletic training, to be honest with you. I miss being outside, first of all. It's kind of funny. At lunch, I'll just do like my little lap at lunch just to get outside. I'm like, I just need to be outside at least for an hour. But I definitely miss being outside. I miss like, that bond you build with athletes where you see this athlete from like day one till the end of the season. I mean, I see a little bit of that in urgent care, but not like you did as an athletic trainer. It was that bond. And even like with the other athletic trainers, not saying like PAs are like very like mean and like no one gets along, but I just think I don't know, I just feel like as an athletic trainer, there's just more of that family atmosphere. I mean, even like just going to conferences, going to an athletic training conference is way different than going to like the state PA conference. Just because there's just so many PAs, whereas like I feel like as an athletic trainer, we're just such a family in general. So there's definitely a lot that I do miss, which is why I'm still trying to stay involved where I can. But yeah, I definitely miss it.
It definitely is a small world.
Oh yeah,
it is. Mm-hmm. It is.
So, do you have any other tips for those ATs that are kind of teetering on the I'm thinking about doing PA, but I'm not sure? Do you have any tips for them?
I would definitely say make a list. Like, why do you want to be a PA versus why you want to stay an athletic trainer? And I mean, I think both are great. I mean, I'm always going to say I'm an athletic trainer first and a PA second. Like, that's just always going to be who I am. But I would say just go shadow if you can. Go find, ask your team doc if they have a PA that you can shadow. I would just say go shadow, go see what it's about. I mean, it's different. It's not easy. School's not easy. It's tough.
So
Yeah.
I've heard. I heard that PA school is really tough.
Yeah, it's definitely tough. I went to a 3-year school. Some of them are 2, some of them are 3, just depending on where you go.
Wow.
Yeah. So it's not easy. It's tough. You're in class for 8 hours a day, and then you go home and you study for whatever time. So that's why I feel like athletic training prepared me for that, because you're either out in the field all day and then you got to go home and study. But it's tough. But I say make a list. Why do you want to do this versus why you want to do that? I think that's the only way. And then just also, I mean, it's very similar to athletic training, but make sure you have a good support system, whether it's like your husband, your family, your parents, whoever it is. And even stability, financial stability, because there's no way you can work while you're in PA school at all. I mean, I got away as an athletic trainer, like working at Disneyland like once or twice a week, but I honestly don't know how I did that. But as a PA, there's no way you can even do that at all. Or in PA school, I should say, in PA school. Yeah. But I mean, it's worth it if you're willing to put the work in, but it's definitely tough.
And I like the support system part, and I think that goes for like any healthcare profession. You know, you need someone who's very understanding, or someone you can go to who at least can empathize with what you're going through.
Mm-hmm. Yeah, because in rotations you see a lot. You see a lot more than you would out like on the field or as an athletic trainer. You see death like firsthand, which I mean, sometimes you do as an athletic trainer, but I feel like you see it more. You just see a wide variety, especially in your rotations, wherever you're at. So it's just definitely having that support system for sure.
Were there a lot of athletic trainers when you were going through PA school?
I was actually the only one in my class who was an athlete. Well, let me go back. I was a certified athletic trainer. The other one took some Canese classes. Yeah. So I was a certified, but after, let's see, the class before me had one. Yeah, there was like 1 or 2 in every class.
Oh, interesting. Okay.
That's
Yeah,
the
about
same
1 or
as
2.
I was talking to another PA ATC, and he said that he was the only one.
Yeah. So it's not as common as people think it
Right.
is.
I
think it's just yeah.
No, go ahead. Yeah, I was just thinking, like, a lot of ATs, like when you talk to them, they kick that around. So you would think there'd be more.
Yeah, you definitely would think there's more, but I think when it gets down to it, like I said, there's a lot of prereqs you have to take. And it's, if you've graduated and you're like, I'm done, I'm not taking classes anymore, it's hard to go back again. So, and it's hard to take all the exams, the MCAT, all that stuff again. So,
right.
Yeah.
Ooh, you got to take the MCAT?
I didn't take the MCAT. I forgot the other one, but you can take the MCAT. You have 2 options. I know some of my classmates did, and I was like, what are you thinking?
That's brutal.
Yeah. I was like, why would you do that? But yeah, there's a lot of prereqs that require a lot of things that they need. Hours, hospital hours, patient care, non-patient care. It's a lot.
Oh, that's interesting. That's crazy.
Mm-hmm. There's a lot before you even get in.
You know what? I do have one question for you, because our college association doesn't allow PAs to sign off on physicals.
Oh, yes.
But I know the scope of a PA. And I want to know your take on PAs and physicals, kind of knowing what you said earlier too.
I see that a lot, where a patient or an athlete comes in and needs it signed off by an MD. But to be honest, I feel like a PA would, no offense to the MDs, but I feel like a PA does a lot more thorough job with physical exam skills. And I think just overall, you can even talk to many MDs that I've talked to, and I think we just focus so much on physical exam skills that we can catch if like there's a murmur, or we've just been trained so well in that scope that I don't see why it's such an issue. We work together. We do the same thing. I know some clinics where the PA will do the exam and the MD will sign off. That's very common. So, and even like where I work at, we'll do a co-sign. So I'll sign it and then the MD will co-sign it as well. So I still am not understanding why that's such a big deal from a PA standpoint
Right.
and an athletic trainer.
Right.
But it just gives more headache, I feel like, to the athletic trainers and to the athletes, because here they are trying to find someone to sign off. And most clinics, I know most urgent cares will only employ PAs or nurse practitioners now. Yeah. So it makes it a lot more difficult. But yeah, I don't know the laws on that.
Yeah, I wonder if it's just an old school thing, and then just as the new generation of ATs started getting into those positions, it's just like, oh yeah, I mean that's what we do. I don't know.
Yeah. So yeah, that's a good question. Yeah, I see that all the time, and it's frustrating for me too.
Yeah, it's frustrating for us too.
Oh, definitely. Because like you said, like multiple times I've had kids come back, and like as much as I trust, the PAs to do it, it's just like, I'm sorry, I really need the MD signature because that's,
Right.
That's what we're requiring. So, and then the athlete's like, oh, I got to go back. I'm like, yes, you do.
Yeah. Just tell them to have someone co-sign, because there's someone that's supervising us, so they can definitely co-sign that. Yeah.
Absolutely.
Yeah. So if we can figure out why that is, that would be great. Who made that law?
Exactly.
Yeah. Who made that law? Because I don't know. I would say we do pretty good physical exam skills.
You ready for the
action? I was
action,
just
then?
about to ask you. You ready to do some action?
Let's do it.
All right, go for it, babe.
Leslie, what would you like the AT community to know about PAs? If you could sum it up.
We're friendly. I'm just kidding. Just that I think AT and everyone in general is that we work with the MDs. We work together. We collaborate. We're not under anyone at any point at all. We're our own providers. We can provide good care. So I think just in general, I think people just need to realize that we're not the physician's assistant. We're not their assistant. We work together just like anyone else would. But I think for athletic trainers, I mean, definitely trust your PAs. Go out and get to know your PAs at the local clinics, because they're going to be the ones that you hang out with. Not hang out with, but the ones that you send your athletes to. You can hang out if you want. But it's kind of like as a high school athletic trainer, they always say, like, get to know the janitor, because at the end of the night, the janitor is going to be the one that's helping you with keys or with whatever you need. Because at the end of the night, that's all who's on campus at the end of the day. And I feel like the same thing goes for PAs, especially in like an urgent care. I just speak more from an urgent care setting, but I feel like the PA is going to be your go-to. They're going to be the one that will help you get in to get x-rays. They're going to help you with the referrals. As a PA, we really push for our athletes, our patients. And that's one thing they really push in PA school is you need to fight for your patients, fight for your athletes, which is just like how athletic trainers are. You want the best care. So yeah, we're very, very similar for sure.
And friendly.
And we're friendly too. We're friendly. Come see us. We're not scary.
It's really cool to see how autonomous PAs really are.
I know. We brought it up with like the whole like physicals aspect and stuff like that. Like, you just don't realize how like autonomous a PA can be and just the skill level that they have.
Right. And I think without being an athletic trainer, it's kind of hard to see inside what we do. But without being a PA, like without talking to one, without delving into their scope of practice, you really don't see that from the outside.
Oh yeah, absolutely. And again, just like every time we do these episodes, now I'm like, oh man, PA, that's pretty cool.
So if you guys are new, we do every other episode as education or stories. This one was an education episode. Next week, we are going back to our stories. We don't know exactly which one we're going to do next, but I'm going to give out a bunch of topics that we're thinking of. First, how to be a great host athletic trainer.
Ooh, that's so underrated.
Building rapport with your athletes, coaches, and admin. Most memorable return to play. and creative modifications you've had to make to return an athlete to play.
I mean, that just screams AT.
Right. So if you have any of those stories, go ahead and shoot us an email or send them over to our Instagram at AT Corner Podcast, where we're also going to post upcoming topics where you can respond in those prompts. And if you want to comment on this episode, you can go to our Facebook group, facebook.com/group/AT Corner Podcast. And there's only one question to get in. It's how did you hear about our podcast? And then you'll automatically be let in to network with other listeners of the show.
Absolutely.
Randy, you got anything else?
Nope, that was perfect. Thank you for helping us showcase athletic training behind the tape. Bye.